Welcome back to This is VANCOLOUR. In the last 7 months, we've had two major elections in BC, a provincial election and a federal election. One major issue that seemed to be missing in both of those campaigns was climate change. Obviously, a lot is happening in the world, but is it time to recenter climate change in the public discourse? Here to discuss is the president of the Canadian Association of Physicians for the Environment, a clinical assistant professor at the UBC Faculty of Medicine, a columnist for CBC Vancouver, and a family doctor, Dr. Melissa Lem. Dr. Lem, thanks so much for being here tonight.
Thank you so much for inviting me on your show.
Absolutely. Okay, so we've had two elections, but I would say all three levels of government, federal, provincial, and municipal, here in Vancouver at least, seem to not be talking about climate change so much anymore, and in fact, may be pursuing policies that are antithetical to climate change action. Is it just me, or does it feel like we've kind of forgot about this issue?
Well, the first thing I want to do is disabuse politicians and the general public of the notion that we don't care about climate change. The latest peer-reviewed research says that around the world, 80% of people want their governments to take stronger action on climate change. And here in Canada, it's almost 70%. So we've almost been gaslit in this movement into thinking that no one cares about it, that we're kind of this fringe, kind of lefty movement, but it's actually the majority of people who care about it. So if you care about climate change, you're not alone. And also, there's this phenomenon called recency bias. And it's funny that you mentioned the federal election, because I first heard that term come from Mark Carney, our new prime minister himself. And it's this phenomenon that goes to human psychology. It says that we focus on, for our own survival, things that are right in front of us. And if you think about the last federal election, it happened in 2021. And I don't know if you remember it, but it was a terrible year for health professionals and everyone in BC in general.
That pandemic. I black hole that entire era, to be completely honest with you.
But also the heat dome, right? That killed over 600 people in 1 week. Record-breaking wildfires, the most expensive weather-related disaster, extreme flooding that year. And so it was on everyone's mind. And it's no wonder it made the top three concerns. And the last reason I would say is people lack education around climate change. So even though almost 70% of us want climate action, unfortunately, the research also tells us only 50% of people know that fossil fuels are the main driver of climate change. And so you can have on one hand people saying, I want you to take stronger action on on climate change, but then saying, oh, but it's okay to build more pipelines. So it's an education issue as well.
Okay. But it does feel like, at least politically, we're not talking about it as much, right? Like, certainly it doesn't seem to be anything that, at least in the last two elections we've had, that any of the major parties were campaigning on.
Well, it's interesting because we know that different, like Leger and other pollsters do these polls on the top issues of concern for people in Canada. And climate change has fallen off that top 5 list. And so naturally, politicians are going to talk about what they think the electorate cares about. But in fact, like I said, close to 80%, 70% of people within Canada do care about it. So this is something that I think would galvanize regular, everyday folks if actually politicians were to talk about it and prioritize it.
Are we looking at climate change all wrong, like maybe in its own silo, where perhaps it should be a lens to things like health or the economy or infrastructure? Maybe would it be better suited to be this lens as opposed to its own independent issue?
Well, the interesting thing about climate change is that it is a threat multiplier. So whether you're talking about cost of living, whether you're talking about healthcare or the economy, it makes everything worse and harder to access. So I just want to talk about two issues that are top of mind for politicians and for the electorate. So one of them is health and healthcare access. So we know that recent research from Harvard tells us that 1 in 5 deaths worldwide are due to fossil fuel combustion. And we know that fossil fuel combustion is the main driver of climate change. And guess how many deaths in Canada are related to air pollution from fossil fuel combustion?
I have no idea.
It's 1 in 7.
Wow.
This is a really, really high number. So the industry that's driving climate change is also directly killing people in Canada, not to mention the heart disease, lung disease, mental health effects that come with it. And then if you think about here in BC, the LNG and natural gas or fracking industry is a major driver of climate change. And I've personally spoken with doctors, at least several doctors who have left Dawson Creek. So this is a city that's in the middle of fracking country. It's surrounded by 700 fracking wells. And they told me that they, in fact, picked up their families and moved them away from this community because of their direct concerns about the health and community impacts of fracking. And we've heard over last summer, the previous 2 summers, we have ER closures, there's not enough family doctors. Well, these industries are quietly driving doctors away from these communities. So, and then cost of living is another issue. So if you think about how our government is focused, our provincial government is focused, it seems, on approving.
They say they are,
I know,
sure.
but also expanding new LNG and fracking infrastructure. Well, there is evidence from other countries, for example, the US and Australia, that shows that once they started exporting LNG or liquefied natural gas, which in BC is majority fracked in Northeast BC, to other countries, that in fact their natural gas prices domestically skyrocketed. So in Australia, within 2 years, in fact, their natural gas prices tripled and stayed there. So my patients talk to me all the time, when I give them advice about healthy diet and eating healthy food and a plant-rich diet, they're barely making ends meet. And if you think about it, here in BC, we could see our natural gas prices to heat our homes and cook our food triple, potentially, if it follows Australia. And the government itself actually projected that next year we're going to see natural gas prices higher by about 50%. And we already saw an 18% hike at the beginning of this year. So it's all connected. Healthcare, health access, cost of living, and climate change, and the fossil fuel industry is driving both of those.
So what I'm hearing is climate change is real. It's affecting us in a multitude of ways. People do care about it. And yet our politicians are doing what they do best, which is gaslight the public and, not talk about this in the same way or the same importance where it should be talked about.
Well, I wouldn't say that all politicians are trying to gaslight us into not caring about climate change.
We can stereotype them. That's fine.
It's more the fossil fuel industry, I would say. They've run these misinformation and disinformation campaigns within our own schools, within the general public, to convince us initially that climate change doesn't exist. And now that expanding fossil fuels can be part of a sustainable future. And we know it's not. We're already seeing those health impacts right here in BC. So I mentioned the heat dome, the wildfires. This increases mortality and increases all kinds of diseases and drives healthcare costs. In fact, the Canadian Climate Institute estimates that if we continue on this high emissions track, that by mid-century, we are going to be spending an additional $110 billion per year on healthcare costs from climate change.
Wow.
This sounds like it's really far away, but I'm still going to be practicing in a couple decades. And it's already hard to practice in this environment with kind of low healthcare budgets and a growing population and growing health costs. So I don't know about you, but I don't know where we're going to find an additional $110 billion per year by mid-century. And the best and the most economical solution is to take action to reduce our fossil fuel consumption, to engage in all these different actions that have co-benefits for us, like active transportation, like public transportation that clears our air and reduces our reliance on fossil fuels, like introducing green space into our neighborhoods, which both sucks carbon out of the air and makes them safer, healthier, and happier places to live.
Absolutely.
Yeah.
Dr. Lem, I appreciate your time tonight and your spotlight on this issue. So thank you so much.
Thanks, Bill.
Folks, that was family doctor, Dr. Melissa Lem. Follow her on Instagram and Blue Sky for lots of insights, especially on the intersection of climate change and health. Now, after some business, are you a people pleaser? That's a good thing, right? Well, maybe not. We'll talk about it up next.